Is it correct that your source for some of these articles was eMedicine?
That's correct.
Can you tell us briefly what eMedicine is?
eMedicine is a website that's created by physicians and reviewed by physicians. It's a reputable knowledge resource for physicians. The articles that are written there are kept relatively up to date, which is one advantage of the website. And they're also peer reviewed, so the articles that are present there are reviewed by other colleagues in emergency medicine, in this case, to make sure that the facts are consistent.
In the report, did you ever mention organophosphates?
No.
Is there some reason you didn't mention organophosphates in the report?
I think one of the reasons was that that the medical record was still incomplete. I know at the time that I didn't have Stephen Ray's medical records, and so I recall that that was one of the reasons. And to tell you the truth, I was considering what possibilities there were. I was considering what possible substances could cause this constellation of symptoms, and those are the two primary reasons.
Now, when did you first begin your review in the case?
It was May of 2010.
And at what point did you begin to reach the conclusions that you've testified to today?
The conclusion that the clinical data does not support heat stroke was really made early on, and I felt that the clinical data did not support that diagnosis necessarily.
How about your conclusion that it could be organophosphates?
I would say that basically my opinion concerning that solidified somewhere around the time or after the time that I composed that letter. And really the piece that I was waiting for was Stephen Ray's medical records.
So apart from the remainder of Mr. Ray's records, is it correct then that you didn't believe organophosphates could be a factor until you saw those remaining records?
No, that was definitely in my differential diagnosis.
Okay, it was your differential diagnosis?
Well, that organophosphates or an organophosphate-like compound could explain all the signs and symptoms that we see here.
Did you have an opportunity to review the police reports in this case?
Yes.
And did those include statements by the various witnesses?
Yes.
And at some point, I think you recently mentioned that a significant factor, and correct me if I'm wrong, a significant factor for your testimony today is the fact that you believe that of the surviving seriously ill patients, none of them suffered any long-lasting effects?
That's correct, yes.
Do you recall whether in interviews those patients indicated that, or some of them indicated that they had suffered long-lasting effects?
I don't remember reading about any significant long-term neurologic sequelae, no.
If Mr. Ray were to have testified to this jury that he still suffers from memory problems after that, would you consider memory problems to be a long-lasting effect?
The long-lasting effects that you would expect from heat stroke, oftentimes they're primarily centered around the cerebellum. The cerebellum of the brain is that area of the brain that controls movement. And so injury to that area of the brain can cause movement disorders, unsteadiness on your feet, etc. And so that would be one of the most common long-term neurologic sequelae would be problems with movement and balance. I think the problem with memory, I'm not sure of the significance of that.
And did you have an opportunity, did Ms. Doe provide you copies of the interviews that she conducted or her colleagues conducted of different people like Mr. Ray, Stephen Ray?
Yes.
And do you recall Mr. Ray, Stephen Ray, indicating on a December interview that he had some other problems at that time in addition to the memory problems?
I don't remember. I remember discussing that he possibly had some neurologic problem, but I don't remember it specifically. And at the time, I didn't make a correlation between the two, no.
Do you remember mentioning to Ms. Doe in that interview that prior to the sweat lodge ceremony, he didn't have memory problems?
I don't recall that, no.
Okay, would that change your opinion about whether he may have suffered some sort of long-lasting brain injury?
Uh, if in fact it's true that he had no memory problems before, and now he has difficult time with his memory, and it temporarily makes sense, then obviously I think it's reasonable to assume that there was some injury. But apart from that, I can't comment further.
Would that be a type of injury that you would expect to see from organophosphates?
And typically, no.
Brain injury then, assuming Mr. Ray testified to the jury that he still suffers from memory problems to this day, would that then no longer be one of the definitive factors that you testified to earlier?
No, that wouldn't change my opinion.
Okay.
And as far as I can tell from the medical record, all of those patients were described as being normal neurologically. So now we're talking about very subtle changes which are difficult to objectively quantify.
Can you tell us the page number, the Bates number of the record that shows that he was described as being normal neurologically?
I don't have that written down. At the bottom, it says, and I have to read this in its entirety to make the point.
Okay.
Due to his brain injury and low-risk profile, we selected to not start ASA or aspirin at this time. He continued to show global post-anoxic brain damage with dysarthria, double vision, gait disorder, and vertigo.
And do you know whether what some of the symptoms were that he suffered prior to the symptoms clearing?
I'm sorry, could you repeat that?
Did the records indicate the symptoms that he was suffering that apparently cleared?
Yes, dysarthria, difficulty speaking, double vision, gait disorder or unsteadiness, vertigo, which is the feeling that the room is spinning. Those are the main symptoms.
Do you know whether it's documented that the patient complained of having memory problems?
I did not see that, no.
Okay. Doctor, if you turn to page 7097.
Yes.
And does that indicate that on October 10th, the patient indicated he is having trouble concentrating and having trouble remembering things with short-term memory?
It does say that, yes.
Let me ask you this. Have you, when you were a physician treating living patients, did you ever treat a patient who was poisoned by organophosphates?
No, not that I recall.
Okay. Have you done an autopsy on a patient who's died from organophosphates?
No.
How about the meetings that you hold? I think you said once a week you get together with other doctors in your office. Are you aware of any of them doing autopsies on someone who's died from organophosphates?
No.
As you sit here today, are you aware of any common household organophosphates that are so toxic that sitting on a spot that had been treated by that organophosphate could kill you?
That's outside my area of expertise.
So, are you aware of any?
No.